Nobody needs cosmetic Botox in the middle of a pandemic, and I think that was a bad decision.
A battle brewing in Beverly Hills after the city council gave plastic surgeons the okay to reopen their doors and their operating rooms. And that move has launched a new debate, with some applauding the decision and others calling it, quote, irresponsible. KTLA 5's Chris Wolf joins us live from Beverly Hills with the details. Chris.
Good evening, Cher. That's right. The debate over plastic surgery resuming here in Beverly Hills continues. The city council, in effect, brought it back this week, but at least one opponent hopes the governor will step in to halt it again amid the pandemic.
I think it would be extremely irresponsible of us, and it would send a terrible message to the world that the first thing we do is to allow boob and butt jobs to happen again.
Beverly Hills City Council member John Mirisch was the sole dissenting voice Tuesday night in a majority vote to allow elective cosmetic surgeries to resume in the city. The legendary, iconic pocket of luxury and privilege in Southern California is home to some of the top plastic and reconstructive surgeons in the world, unable to practice their craft for several weeks due to the coronavirus pandemic. Councilmember John Mirisch is maintaining his stance.
Beverly Hills is the city in LA County with 88 cities that has the fourth highest rate of infection. If you open up plastic surgery for these sorts of elective and really unnecessary procedures, you're also taking away PPE, personal protective equipment, from those who are on the front lines who are actually battling the COVID virus.
Dr. Rady Rahban is a Beverly Hills plastic surgeon and says those in support of bringing back his industry believe the atmosphere is safe enough to do so.
And it's being done so in a way, in a fashion, to the best of our ability that is sensible and gradual. People like to express their ethical thoughts on plastic surgery. That's not the position of the councilman to do. The position is, it's not whether or not having your gallbladder out is more important or less important or more needed or less needed than a woman who has painful breast implants that need to be removed. That's not for us to decide. The question is it safe to do so? And if so, what are the criteria by which we should do it that makes it safe?
Chris Wolf, KTLA 5 News.
In tonight's Health Smart, could an arthritis drug save coronavirus patients?